Millions of Americans, and maybe many of you, are suffering from chronic pain. How do you deal with it? Dr. Vishal Kancherla is here with the Austin Diagnostic Clinic. He's a psychiatrist there. Thank you for being here this morning.
Hi.
Well, talk to me about what causes chronic pain and how many people suffer from this.
Well, there are a lot of sources for pain, but we see mostly inflammatory problems in our clinic. And inflammation is basically what pain is. The body's response to an injury is creating these inflammatory factors. So you could have an injury from a sports-related accident, from overuse, from degenerative changes, and the body's response is to send these inflammatory factors to that particular pain generator. So you can get swelling, irritation, and then pain.
How many people suffer from pain and ignore it and don't do anything about it and just say, I'll work through the pain, it'll go away?
Right. Well, most of the time, your body has an innate way of healing itself. So these minor injuries can heal themselves. But sometimes we have to get them enrolled in a formal therapy program, get them started on analgesics, things like Motrin or Aleve, to help reduce that inflammatory response. Now, if we don't get the response we're looking for with pain relief, and healing, then we sometimes have to take it to the next step. And that's when we start to use things like cortisone injections.
And talk about that. How effective is that?
Well, cortisone is interesting. It's basically a steroid. And steroids are super anti-inflammatory. So once again, pain is inflammation. So when we try to reduce the pain response, we're reducing the inflammatory response. And cortisone works at the level of the inflammation. It blocks the inflammatory factors from causing the pain. And that's how the cortisone works. Very effective because we're able to take this medication and put it right on top of a particular pain generator, whether it's a nerve, in a joint, or muscle, tendon, or ligament.
What are the side effects of cortisone?
Well, most of the time this is very safe because the amount that you get into a particular joint or into your spine is very minimal. A lot of people get some constitutional symptoms like irritability, sleeplessness, maybe some facial flushing. Some people, some of our patients have diabetes and hypertension, so very transiently they can have increased blood sugars or blood pressure. But by and far, if your physician is conscientious of your medical problems, you can really get away with very minimal side effects.
And the word steroid sometimes is a little alarming for people. So how do you calm people's fears about the word steroid and just that idea that cortisone is a steroid?
Right. Well, there's different types of steroids, but the type of steroid we use in these injections is cortisone. It's synthetically derived. And cortisone, or cortisol, is actually produced in your body naturally by your adrenal glands. So when this enters your body, it's not really that foreign to what your body understands. We can be very judicious about how we use it and how often we use it. And if we take pay careful attention to it, really there's no long-term sequela.
And since sometimes the body heals pain, how long should people wait and endure pain before they come and see you?
Yeah, that's a great question. I think you have to judge it by how you feel and your function. If you feel like you're not improving and you've taken the proper steps, including activity modification, rest, taking the medications, maybe going through a home-directed program, a therapy program, or even a formal therapy program, and things aren't getting better, that's when you should take the next step, because you know that your body hasn't produced the normal tissue healing it should.
Yeah. Well, if you are ready to take the next step, you can visit Dr. Kancherla. He is at the Austin Diagnostic Clinic. You can call 901-4061 or go to adclinic.com, and you can even make an appointment there on the website.